Hello, I'm Dr. Jennifer Rowden. I work as an old age psychiatrist in Southampton, but some of my time is spent on the eLearning project as clinical producer. What clinical producer means is that I develop, create and produce e-learning materials with the rest of the e-learning team.
My name is Nick Martin. I'm the Principal Experimental Officer for Psychiatry.
Our project is about producing e-learning materials for psychiatry or mental health for medical students at the University of Southampton, primarily year 3 and 5.
Well, we've tried in psychiatry to cover the main clinical areas that the students particularly need to know. So we've covered depression, schizophrenia, anxiety, also looked at some of the wider, broader aspects of living, such as alcohol abuse, violence, some of those other things that naturally fall into psychiatry as a topic.
University of Southampton medical students, primarily years 3 and 5. But we've had lots of interest from GPs as well, who've helped us to develop the projects as well. I'm sure the audience is going to be much wider than just our students. And of course it's about sharing it with other universities, both in this country and abroad. Oh, a fantastic quality project to supplement, not substitute, the learning that goes on already in mental health.
In psychiatry, we have a shortage of patients. Obviously, the patients that we see are very vulnerable sometimes, and one of the things that is very difficult because of the increase in medical students is actually giving them the opportunity to see cases and to clerk cases. So one of the things that e-learning helps us very much with is to kind of replace the patient scenario, if you like.
It's about using the electronic media, particularly on the web, to produce supplementary e-learning materials for medical students. I think that's particularly important in mental health because we have the students for such a short period of time, and many of our patients have chronic diseases that may have years in duration and go through phases. So e-learning is a great way of showing to students, perhaps even other groups as well, how a disease might develop and change over a number of years. So it allows them to have an overview rather than just a very simple snapshot. Give it a go. Great fun. Keep it, to use Paul Hopper's words, short and sexy. Plan, plan, plan and plan again. Don't be over-ambitious, although it's very tempting. Know your limits. Recruit other members to the team who are enthusiastic and able again as well. And be realistic and start slow. It's been such a huge learning curve. What we did at year 1 we would not do now. So get stuck in. Give it a go.